I was having difficulty urinating. It didn't want to flow evenly. It would stop and start, and I would have to reposition myself to get my bladder to empty. When I would sit down, there felt like there was a lump there. I had difficulty sitting. Would have to shift my body so that the lump would actually go back up into the passage.
Pelvic organ prolapse is a common condition where one of the female organs are dropping through the vagina, such as a dropped bladder or a dropped rectum or a dropped uterus. It is ultimately a form of a hernia that is happening through the vagina.
I could feel the lump when I was walking or trying to sit, and it was getting larger and larger.
The most common organs to prolapse through the pelvic floor are the bladder, where we call them cystoceles, or the rectum, they are called rectoceles, and then on the top of the vagina we can have the prolapse of the uterus, or the prolapse of the top of the vagina after a patient had had a hysterectomy before.
Dr. Antonini explained to me that many women, after having childbirth and getting older, our muscles are getting weaker. And sometimes it's also an inherited factor, which I was surprised to learn.
For non-surgical treatments, usually we can resort to pelvic floor physical therapy or the use of different devices, usually called pessaries. For the ultimate treatment, usually we resort to surgery. There are multiple different operations and techniques that can be used to surgically correct pelvic organ prolapse.
Dr. Antonini gave me treatment options: have the surgery and rectify the problem, or just go on as I was going on, which was very uncomfortable. I chose the surgery. Having this procedure done by Dr. Antonini has been absolutely wonderful. It makes me feel like a new person. I feel wonderful. I feel wonderful.